Hi, my name is Robert Cappucio. I'm a coaching and cultural development consultant here at Cal VEBA. Today, what we're going to do is take a look at some strategies to increase relaxation, mental focus, and help with self-regulation. We're going to be using research-backed tools and insights with practical application that you can use in various situations to perform at your best and mitigate stress in any situation in your life that's particularly important to you. So a good place to start is diaphragmatic breathing. Normally when we take a breath, a lot of times what will happen is we'll notice our chest rises. Like if you can get to a mirror sometime after you watch this video, just take a deep natural breath and notice if your chest rises or not. What we're going to do here is work to make sure that doesn't happen. We're going to keep our chest from rising, and rather, as we inhale, we're going to focus on our lower abdomen extending outward into our waistband or our belt, kind of like after you've eaten a really big meal. You know what I'm talking about. What else we want to focus on is, in addition to our belly protruding as we inhale or take a breath in, we're going to allow our rib cage to slightly expand out and backward. So if you were sitting down in a chair like I am, when your belly protrudes, you would also feel your ribs filling the back of the seat behind you. So breathe normally at a pace that's comfortable for you, almost as if you're taking a sip of air in through your nose. And practice that. Notice the sensations you feel as your lower abdomen and your rib cage expand outward. Next, just allow the air, almost like a deep sigh, to flow out through your mouth. Sip air in through the nose. Feel your lower abdomen extend out with your rib cage. Keep your chest stationary. And then, almost as a deep sigh, slowly allow the air to flow back out through your mouth as you exhale. So the next technique we're going to look at is something called box breathing. Box breathing is utilized by professionals like the Navy SEALs and emergency first responders to emotionally regulate and stay focused and relatively calm, even in the most high stress of situations. We're going to take a diaphragmatic breath, 4 seconds, inhaling slowly, almost as if we're sipping oxygen through our nose. So go ahead and do that now with me. 3, 2, 1, and then we're going to hold our breath for 4, 3, 2, 1, and then for 4 slow seconds, we're going to allow that air to be released through our mouth, emptying all the air from your lungs, and again, holding your breath for 4 seconds before once again taking 4-second slow breaths in through the nose. So this rhythm is diaphragmatic breathing, which means that your belly and your rib cage are expanding outward on an inhalation or taking air in while your chest stays stationary. As you breathe in through your nose, you do it for a count of 4 seconds, hold your breath for another 4 seconds, exhale slow and controlled through your mouth for a duration of 4 seconds, after which you are going to hold your breath again for 4 seconds before inhaling through your nose at another count of 4 seconds, restarting the cycle all over again. So with this technique, it's known as alternate nostril breathing, and this helps to improve focus, balance your brain hemispheres, and again, decrease elevated states of arousal, keeping you calm, alert, and reducing the level of stress that you feel that you're under. And how this works, just like the name says, is you'll start by covering one nostril, let's say your left nostril, and then with me, you're going to very slowly inhale through your right nostril. You're going to hold, and this time cover your right nostril, and very slowly exhale through your left nostril, repeating the cycle again for a couple of minutes. The next technique we're going to talk about is coherent breathing. What's unique about coherent breathing is it helps to regulate what's called heart rate variability. So between each beat of your heart, it's not consistent, but there's variability within the space in between. What the research shows is the greater or the higher the level of variability, the greater the emotional regulation. So how we would do this is simply take 5 to 6 breaths per minute. This could be as simple as taking 5 slow diaphragmatic breaths. Again, that's breathing very slowly in through the nose for a count of 5. 4, allowing your belly and your rib cage to slightly expand. 2, 1, and then very gently exhaling through the mouth for a count of about another 5 seconds. You'll feel your belly and your rib cage almost kind of deflate back to the normal resting position.